Sir, what are the signs of a bone infection and how a person should recognize it early?
So first thing is the wound which should heal in normal span of time. If it is not healing, it is taking a longer duration of healing. So then you should be doubtful that it has got infected. Second thing, there will be fever. If the patient is having any fever, or the wound and surrounding the wound, if it is red and it is more painful, then these are the signs of infection. If there is any discharge from the wound, or if there is any pus pouring out from the wound, these are all signs that the wound has got infected.
Okay.
And this will immediate medical intervention is required even if it is a small wound.
Means if there will be any kind of color changes?
Color changes,
Fever?
if there is any redness, any fever, pus discharge or
Okay.
wound discharge, or it is taking unusual amount of time for
Time.
healing. So
Okay.
these are some signs of infection.
Okay. Thank you, sir. Sir, what I've seen in our India, due to some crackers firing, or like Diwali, due to burn injuries are common. So,
Yes.
what are the most common type of burn injury do you see in Diwali or after Diwali?
During the Diwali time, more common burn injuries are with the kids and with the women. Usually household injuries because of the firecrackers and cracker blast injuries. These usually happen in the hand.
And
So hand injuries. And if it is a smaller cracker, that won't be it will be more of a burn injury itself. And diyas one of the most common burn. And because diyas,
Okay.
problem being with the diyas, they are usually kept on the floor,
Mhm.
and our women have saris
Saris.
and dupattas. These will be freely floating in the air. So whenever they catch fire, usually they don't know. By the time the whole body gets fire, they would be knowing that, oh, okay, I got caught fire. It is too late by the time.
Yes.
By the time whatever the damage should have been done, it is already done. So diyas are the most common and most worst burns we have seen with diyas. Usually in the puja rooms also,
Yes.
they will be praying or they'll be doing some prasad or whatever, and they'll get caught fire. This is more common. And recently with newer crackers, newer burn injuries will happen, and cracker blast injuries. People will be shoving this gunpowder into this cracker materials. During that, if any burn happens because of the pressure, that will cause blast injury. When there is a blast in the hand, it is not only burn, it is also injury to the hand. All the small bones in the hand get fractured, multiple. The hand gets literally crushed. It will get blast, and it is a very devastating
Yes.
injury. This is usually very common in youth. Once it happens, if it has happened to this right hand, and it is gone, it is very tough to salvage the limb. And even if it is salvaged, we don't know how functional the limb will be again back. So very devastating injuries. This cracker blast injuries, anything blasts in the hand. Once the hand is gone, the person
Yes.
livelihood is gone.
That-
Yes, that is a problem.
Sir, in rural areas, typically like hilly areas, so to get such kind of doctor facilities little difficult. Even
Yes.
hospitals are there, but doctors are not there.
Okay.
So in that condition, what's your advice?
In that condition, then if there is a burn, and first thing is cool down the burn wound. Once the cool down the burn wound, clean the burn wound with a clean cloth and cover it with a clean cloth. And you should encourage the patient to take more amount of fluids. And in that fluids in particular, you can take some ORS fluids, or you can take some sugar and salt. If there is no ORS also, take some fluid, say water. You mix some sugar, you mix some salt in that, and ask the patient to consume more of water, because there is more loss of water. Intravascular volume will get reduced in the burns in the first 48 hours. So
Okay.
this is important. At least you take 4 to 5 liters of fluid for a healthy adult. That is
Okay.
minimum. So fluid plays a major role. Still, you can't get any medical attention. We advise the patient to take more of protein diet. So more of eggs. These are more important. So immediately water is the main thing. So we can at least advise the patient to take more of water, hydrate himself, avoid dehydration. That would be the best thing they can do.
Okay.